I'm so proud of Bellin because we do put the patient first, and we found a need.
We were growing out of our space. We needed to have additional space.
We weren't meeting needs already for a number of maternity rooms that we had, and then we didn't have a space for neonatal intensive care patients.
I'm a labor nurse at heart, and it was hard to see our parents be separated from their babies all of the time when they needed that higher level of care.
So we really went to the board and said we need more room. And I love our board. They embrace what do the patients need.
We knew that if we were going to build a NICU, we wanted it to be different than what existed in the area.
This dream became how could we do it and do it even better? How could we excel at it? How could we create something that is unique to the state of Wisconsin and beyond? There was a new model of care, family integrated care, where baby needs that higher care, but mom can come along that baby's journey with it as it heals, and they can heal together.
The mom usually stays for maybe 2 days after the delivery, but she continues to stay in the room, and the team continues to treat her, not necessarily as a patient, but they continue to care for her, you know, as a postpartum mom. She doesn't stop being a postpartum mom because she is not a patient anymore, and they continue to treat her that way. Being an experienced NICU nurse that's worked in multiple different types of units, one of the big things that I see as a difference is that our families are much more comfortable with the care of their baby. In a typical design, the parents a lot of times learn how to care for the baby in that last day or two before discharge. Here's stay for 24 hours so you can learn how to take care of your baby and go home the next day. In our unit, they're learning from day one and continuously learning throughout the whole stay.
And it really lends to better health outcomes for the mother, for the babies, and for their families. It better helps prepare mothers with babies in the NICU. It's a really coordinated care team of individuals and nurses that help people to understand what it takes to raise a NICU baby and get them the best care that they need.
I can't tell you how many times we have heard from grandparents and family members and people who have had their loved ones benefit from this project and talk about how having that model or having that new room in maternity or the ability to have the tub, those are some of the things we get to hear as the foundation and hearing from people who have experienced it, and that is so special to hear that and what an incredible impact it is having in this community.
It's been incredible to hear the family stories and hear the patient outcomes that have improved because of this. Babies are being discharged sooner. Parents are able to bond with their babies because they're not separated. And it's just been really impressive to see how people have responded and really emotional as well.
Being a NICU nurse for 20 years, this was a dream come true back then. Never thought it would be a possibility. So to find out that Bellin was doing it was just amazing to me, and everything that I thought it would be, I think it's that and more.